David Munday, the public health consultant for Reading. And my role here is to have oversight of health and well-being of residents in Reading and to coordinate various programmes, activities, initiatives, services that improve health and well-being. Now, that's always included infectious diseases, for example, supporting access to vaccinations for things like flu or meningitis. But since March, my role clearly has been very COVID-19 focused. And my role's really been to help apply national public health advice to us locally to make sure it works for Reading and to ensure we do the things we can here to minimise outbreaks and to reduce transmission of the virus as much as we possibly can. So what I'm talking to you today about is really our local situation in Reading as it is currently, and to answer some of your questions about COVID-19. So firstly, we are seeing infection rates increasing across Reading. We're heading back towards that same spread of infection we saw back in late March and into April. And I'm sure, as you've seen in the media, this is in line with what we're seeing nationally as the virus is becoming generally more prevalent again in our communities. And often it seems to be within younger populations at first, but then also spreading much more widely and including older people too. So our goal in Reading is to prevent local outbreaks and to prevent local lockdown. We're currently in tier 1 of this new 3-tier system that was announced earlier in the week. We want to stay as low down those 3 tiers as we possibly can over the coming months. Of course, that's what we all want. And at this time, although we're in tier 1, we can't be complacent in Reading. Infection rates are increasing across the town, and we need to keep the people we love safe and help everyone get back to the things that we all want to be doing as soon as we possibly can. So my message to you today is to say, please help us all do this. And the most important ways you can help reduce infection rates are as follows. But remember, it's no one of these measures that by themselves is sufficient to control and beat the virus, but it's when we all do all of these things all of the time that we are most successful. So wash your hands with soap and water often, and as I'm sure you've heard, this should be for at least 20 seconds, and using hand sanitizer gel if soap and water aren't available. Always wash your hands as soon as you get home from being out in various locations. Please wear face coverings to help protect other people. This is particularly important if you are in enclosed spaces and mixing with people you don't usually live with. And the requirement to wear face coverings is now set out in government law. The face covering should cover your mouth and your nose because that's obviously where the virus transmits from in these respiratory droplets. You should stay at least 2 meters away from anyone that you don't live with or who's not within your support bubble. You should avoid touching your eyes, your nose and your mouth if your hands aren't clean. We, of course, have heard a lot about the rule of 6. It is really important that we only meet up in groups of 6 or less. This is a legal requirement everywhere in England. And when you meet people from outside of your household, it is always better to meet people outdoors if you can. It's safer and the fresh air provides better ventilation and reduces the chance of transmission of the virus. In locations such as churches, gyms, restaurants, etc., where there are more than 6 people that are present, they're operating under COVID secure guidelines, and we have done risk assessments with them to be taking the measures to keep all of us safe. It's also important that people isolate and get tested if symptoms develop. And the 3 symptoms that we want people to be vigilant for are the development of a high temperature, a new continuous cough, or the loss or change of your sense of smell or taste. It's also important to respond to the NHS test and trace programme. So people who test positively in Reading automatically get contacted. So if you receive a call, please respond, please provide the required details of those that you may have been around recently. This means that contact tracing can work most effectively and isolate off the virus, giving it less opportunity to spread around our communities. If you're asked to isolate at home by NHS test and trace, then you must do that. As inconvenient and as difficult as that is, it's really important. Now, as I'm sure you can imagine, I often get questions about a whole range of things to do with COVID-19, and I'm happy to answer as many of these as I can. In the last week, a lot of people have been asking about schools, and if, like me, you have school-aged children, you'll be aware of all of the hard work that head teachers and all of their staff in schools have been doing to get schools fully open since early September and then keeping them open. And despite increasing infection rates in Reading, we're not really seeing that within the school-aged children population. And schools do remain a safe place for children to be. Your school will be taking many measures and have completed risk assessments to keep you and your children safe. And inevitably, we have some school bubbles in Reading that have needed to be at home for 14 days because of COVID infection. If I'm honest, this is business as usual for us now in schools and will remain part of how we manage COVID locally in the coming months. It's really important to remember to do the social distancing at school pickup and drop off, and the rule of 6 when mixing with other parents and even on play dates all still applies. We also want to keep our playgrounds open for as long as it is safe to do so. And we know that these provide children a chance to exercise, to learn through play, and to socialise, albeit in slightly different ways currently. So the same rules apply here within playgrounds: social distancing from people you don't live with, not meeting up in groups larger than 6, hand washing before and after play is important, as we know the virus can survive for several days on hard surfaces. So finally, if your child has a cold, what do you do? Well, remember the 3 main symptoms: the temperature, the cough, and the loss of taste or smell. And if you or your child show any of these symptoms, isolate and get a test. So let's do the right thing for Reading by following the advice and stopping the rise in infections. If you have questions you'd like answered going forward, then of course please let us know. I can't promise I have the answers to all of your questions. This is still a new virus and we're learning all the time. You can email our email address for questions, so that is communications@reading.gov.uk, and we'll share the answers via these videos and on our residents' email and via social media. Thank you.